We're going to get started here. It's now 6:01, so we'd like to get started. As everybody's signing in, I will start the presentation. Good evening and welcome to Robert Wood Johnson University Hospital. My name is Jack Morris, and I am the chairman of the board. Thank you for joining us tonight in our public meeting. As many of you may know, the New Jersey Department of Health requires all New Jersey hospitals to host public meetings like this one. When the Department of Health started this effort in 2008, it was an important step to increase transparency amongst all the New Jersey hospitals. Tonight, you will learn more about our academic medical center's vast range of programs and capabilities and our plans for the future. You will also have a chance to ask questions, which we will take your information and get back to you with any questions and answers that you may have. We will limit tonight's presentation to 5 questions and to 5 minutes. There will be presentations tonight, and at the conclusion, we will allow everyone to ask the questions. Thank you again for taking the time out of your busy schedule to join us, learn more about our nationally distinguished academic medical center. Now, I would like to turn the program over to our President and Chief Executive Officer, John Gantner. John, would you please come on?
Thank you, Jack. So as I put this up here, good evening, everybody. Welcome, and thank you for coming to our annual public meeting. Nobody wants to sit in the front row. Reminds me of high school. So anyway, we have a deck that I will run through, but certainly at any point, if you have questions, don't hesitate to ask those questions. And then when I'm all done, you may have more questions. So let me start by, because this is our annual public meeting, let me begin by talking about the mission of the hospital. You can see the 5 bullets here that summarize our mission. I would just point out a couple of the bullets, just call them out. So the first one is really, it's our clinical mission, so providing high quality, evidence-based medical care. We're an academic medical center. Providing care is very much a part of our mission. I would talk about the second bullet, advancing patient care by the diffusion of medical knowledge. Again, being an academic medical center, academics, education, it's part of what we do. We like to think of ourselves as being on the cutting edge and being among the first institutions nationally to translate research and new practice into community practice. And then I would point out medical discovery, the third bullet. We're committed to research. So those 3 bullets are very much a part of our mission. We're also fortunate to be an institution and to be part of a system that has a tremendous social compass. So part of our mission is also community benefit and providing community service. So that's an overview of our mission. Our vision goes along with that. We strive every day to be high quality, to be a nationally distinguished academic medical center. The opportunity to do that certainly was enhanced through the relationship with Rutgers and the academics and research and education that goes on in that wonderful university. So we are part of, effective 2016, March of 16, Robert Wood Johnson University Hospital and the Robert Wood Johnson Health System formally became merged. It was a merger of equals with the Barnabas Health System, and that made us a very, very large, comprehensive, integrated delivery system. with a large dose of academics, which distinguishes us from many other integrated delivery systems in the state. We care for 3 million people, 32,000 employees. I would say that since this slide was put together not too long ago, many of those metrics and these metrics have gone up, because if you paid attention to the paper in the last 3 or 4 weeks, other hospitals have signed letters of intent with our system. So these numbers could easily go up by 3 or 4 hospitals over the next couple of months. So the system continues to grow. We also have a pediatric state rehabilitation hospital, children's specialized hospital, that happens to be the nation's largest pediatric rehab hospital as part of our portfolio of services. We have behavioral health, we have ambulatory care centers, we have all the elements that make an integrated delivery system with a full continuum of care under systems control. And now, I guess if I double click, do I get the video?
A new state of health for New Jersey, for the nation, and for the world. With the partnership of RWJ Barnabas Health and Rutgers University, it's the dawn of an incredible new era in health. Jointly, RWJ Barnabas Health and Rutgers University will operate a world-class academic health system dedicated to high-quality patient care, life-changing research, and clinical training of tomorrow's healthcare workforce. By partnering, these two higher education and healthcare industry leaders will improve access to care and reduce health disparities in New Jersey and across the nation. At the center of all of this are the patients, who will benefit from increased access to a world-class academic health system, clinical innovation, groundbreaking research, and newly developed centers of excellence, as well as more providers that families need to manage their health and wellness. RWJ Barnabas Health and Rutgers University, the dawn of an incredible new era in health.
So that was a quick video that was put together shortly after the merger occurred. It's still very relevant because our mission, our combined missions has not changed. This is just a snapshot of our campus. I once did the measurements on it, so we actually span about 8 city blocks in length, and at the widest part, probably 5 blocks wide. So we really have done a lot of growth and added a lot of good programs and a lot of good healthcare and a lot of good research and a lot of good academics to right here in the center of New Brunswick. There's one building that's actually not pictured here because the picture's a couple of years old. That's our East Tower, but that goes basically right over to the trestle of Albany Street. So we're very proud of the way we've grown and how we've grown and the programs we've added over the years. This is, we talked a little bit about the system, now I'm focusing on the hospital itself. 600 beds, about 2,000 physicians and medical staff, 450 residents, a little over 5,000 employees. You can see the metrics. We treat over 30,000 inpatients every year, hundreds of thousands of outpatient visits, and the emergency department's running about 92,000. I think when the new emergency department opens just in 30 days or so, I think we'll be seeing numbers of about 100,000 emergency department visits a year with that expanded ED. In terms of our market, it's all in Middlesex and Somerset counties, but our market goes into Union, Mercer, Monmouth, and Morris counties. But the fact is that every year for the recent, as long as I can remember, because of our level 1 trauma service and designation, we have seen patients from, at least one patient from every county in the state of New Jersey, and we get patients from out of state as well. So we have our primary service area, but as a regional referral center, as a trauma center, we get patients from a much wider area. Additional information about us, I mentioned we're a level 1 trauma center. Our pediatric trauma center was the first designated pediatric trauma center in the state. We are a leader in statewide emergency preparedness. Unfortunately, we really started that journey after 9/11. We learned a lot of lessons, I guess the hard way, but we have retained a leadership position in terms of helping New Jerseyans through a major crisis. And very recently, we acquired our own helicopter. The system acquired a helicopter. So that allows us to respond more rapidly to traumas, but it also allows us to move patients between and among our hospitals as service needs dictate. More about Robert Wood. These are our centers of excellence. I like to say sometimes that we are several hospitals under the roof of a single hospital. We have a dedicated children's hospital. We have a cancer hospital within our hospital. We have a cardiovascular hospital. So we have really what other people might consider full scope hospitals, specialized hospitals. We have many of them under the guise of, or under the mantra of Robert Wood Johnson University Hospital. These are our centers of excellence, so I mentioned a few of them, but I'd also have to mention neurosciences, neurology, neurosurgery, advanced endoscopy. We moved a team here from Cornell a couple of years ago, so we have tremendous capability in advanced endoscopy. We're a leader in bariatric surgery, both in terms of the number of cases we do, but also the quality of the outcomes here. We have a liver disease center with the help of the auxiliary in large part. And we do solid organ transplant, heart, kidney, and pancreas, and we do bone marrow transplant, and very recently started doing CAR T therapy as well at CINJ. We are the principal teaching hospital for Rutgers Robert Wood Johnson Medical School, and that relationship goes back decades. I think the original affiliation agreement between Robert Wood Johnson University Hospital and then UMDNJ was back in 1977, and that relationship has only expanded and deepened since that time. And we are fortunate and proud to be the flagship cancer hospital of Rutgers, the Cancer Institute of New Jersey, which is an amazing success story in itself, CINJ. This is the Bristol-Myers Squibb Children's Hospital. So again, I mentioned we're a number of hospitals all baked into a single hospital. We have on the, I guess that would be the western side of our campus, we have a pediatric campus. So we have our acute care, Bristol-Myers Squibb Children's Hospital. We have Children's Specialized, which is acute pediatric rehab, but we also have the Child Health Institute, which is a creature of Rutgers University where we do pediatric research. So that is, I consider that to be the pediatric center of our campus. There's a couple of slides here with some recent achievements. The print is very, very small, so I'll help you along, but I won't read every word. This year we were fortunate. If you look at those first several bullets, we unveiled a new critical care unit. It's a state-of-the-art. I use the word Star Wars when I describe this unit, but it really goes along with us being the comprehensive primary stroke center. We also opened, it's probably on the next slide, but I'll mention it now, we opened a state-of-the-art cardiovascular intensive care unit because cardiovascular care is a huge part of the services that we provide. We are at the tail end, fortunately, of what has been a 2-year emergency department renovation. We went from about 40,000 square feet in there. When it's all done, it'll be about 60,000 square feet. But in addition to just extra space, the bays where we see patients are more private. The diagnostic capability there is embedded in the ED, so we don't have to move patients around for certain kind of images. And we have trauma bays in there and negative pressure rooms. It really is a spectacular ED. It's, I think, something we've needed for a long, long time, but it was a bold undertaking to try to renovate and expand your ED while you're staying in business. But it's been 2 years in the making. It's been a challenge, but we're a month or so away from being able to introduce the entire completed emergency department. So we're happy about that. Last bullet, Robert Wood Johnson University Hospital is nationally ranked by U.S. News in pediatrics, and we were high rated in 10 adult either specialties or procedures and conditions. That just came out a couple of, maybe a month or two ago, so we're proud about that recognition. There's the cardiovascular ICU. We had our Joint Commission survey earlier this year. We did extremely well on that survey. We're very proud of the results. In fact, the Joint Commission told us that the total number of findings that they had for us after their nearly week-long survey was what they typically find on one day of a typical survey. So we did really, really well, and I thank everybody all the leaders in the room that were part of that. We did so well. Bristol Myers Squibb ranked a top performing children's hospital, specifically in urology. And this last bullet was interesting to me. I never realized this before, but when the American Hospital Association was formed a number of years ago, there were, I think, 50 initial members of the American Hospital Association. We were one of the 50. Who knew? So maybe 2 or 3 months ago, they came here and provided us with a plaque because it was now 100 years that the AHA has been DAHA. So kind of interesting. God bless you. I talked about the emergency department expansion. You know, this thing actually started in April of 17, and the first thing we had to do was lower the street, I think 1.5 feet, so that you could drive into the newly configured emergency department. And the challenges went uphill from there. So we're happy that we're at the end of it, but it was worth the effort and the pain because it's absolutely spectacular. We do our community a tremendous service by adding this emergency department. Now.
What makes a hospital an academic medical center? Being one of only 7 nursing programs in the world to receive the Magnet designation 5 times. A nationally recognized children's hospital with specialties including regional perinatal care. A neuroscience team closing in on the nation's 3rd largest killer. A partnership with the Rutgers Cancer Institute of New Jersey. Cardiac medicine, where hope is transplanted along with hearts. A comprehensive liver disease and digestive treatment center. A bariatric program with long-term results. And a level 1 trauma center that's above it all. Research, education, patient care, everything you'd expect from New Jersey's premier academic medical center, Robert Wood Johnson University Hospital. Let's be healthy together.
So that's a commercial that we put together probably over a year ago now. And what we were trying to do in 60 seconds or less was to really capture the ethos of the organization, some of the premier services, the academics, and we wanted to do justice to 5 or 7 different service lines, but not really cut anyone too short. And so we did a number of runs on this, made a number of modifications, but I know the leadership team is very happy with the final product. And I think I did a lot of talking tonight, but I think in many ways this ad sums it all up. So that would be the end of my formal remarks, and at this point I would open it up for questions.
Is this the Q&A for the community time? Or?
Sure is.
Okay, I have some.
Good evening, board members. My name is Charles Cradaville. I'm a resident of New Brunswick. I'm also the editor of New Brunswick Today, a community newspaper here. I have some concerns. I wrote some questions to Mr. Morris after receiving a phone call from, I guess, one of his representatives, Mr. Brook. And after that, I followed up with Mr. Brook with an email with several questions on October 31st and again on November 5th, and even stopped by their office to try to get these questions answered. And so I'm just going to ask him right here then, does Mr. Morris support the closure of the Lincoln Annex Public School to make way for the proposed Robert Wood and Devco Cancer Institute building in New Brunswick?
So I really can't answer directly for Mr. Morris, but I can tell you that what is under the planning process right now is the expansion of the Cancer Institute of New Jersey, because that Cancer Institute needs to be nearby to the supporting university hospital. There are a limited number of sites in the region that might be able to house that destination world-class cancer facility, frankly, that the citizens of New Jersey really need and deserve. We have some of the highest tumor rates in the country, so I think it's an absolutely necessary project. There's only so many places where it can be built because it needs to be near University Hospital. And I know that the school, what's it called, the Lincoln
Lincoln
Annex? I
Annex,
used to call it St., was it St. Peter's?
It was, yes.
Okay, I think of it as St. Peter's. I know that's one possible site that's under consideration. They're looking at other sites, potential sites as well. And I think that we support the site that would, A, work for the Cancer Institute, because I think New Jersey needs and deserves that. And if we were to choose that site, because that's a possible site under consideration, there would be arrangements made so that students wouldn't be displaced, and there would be a new facility for them that would be probably superior to the facilities that they're in today. So I think that's what the institution supports. I think it's the right thing to do. It's, to my mind, having had a number of family members whose lives were extended through the good work at the Cancer Institute, I think that it's the right thing to do for the state of New Jersey, and we will also absolutely do the right thing for the students that are in that school. You know, if you go back about 25 years, and I was working at the hospital back then, the hospital was really in a growth spurt and was very successful in terms of developing programs and services, and the economics of the institution were strong as well. And we were at a board meeting, and one of our board members was involved with the public school system in New Brunswick, and mentioned to the board that at that time the graduation rates in the high schools were not good. And we sat around as a board, and our board came to the conclusion, you know, we don't feel right having all this success and growth and development and building this wonderful academic health center in a community that's been very good to us, and recognizing that that community has some challenges. So at that point, we worked with the New Brunswick public school system. We actually donated property on which the New Brunswick Science and Technology High School was constructed. And to this day, those students in that high school spend a lot of time rotating, clerking, and mentoring, shadowing with leaders in this hospital. So again, part of our mission is academics. We're very committed to it. We demonstrated that 20 plus years ago with the Science and Technology High School. We would, if that were the site that was chosen, we would once again rise to the occasion and do the right thing because we are committed to academics. People think of us as a hospital, but we are in many ways an institution of higher education. During the academic year, on any given week, as many as 500 trainees walk through the halls of this hospital. They could be medical students, they could be residents, fellows. We have arrangements with over 60 nursing programs in the country, pharmacy, radiology. So we are fully committed to education, to academics. And if that site were chosen, we would absolutely do the right thing there.
Thank you for your answer. My concern is compounded by the joint statement issued on June 3rd. Says, quote, the estimated schedule of completion for the project spans 48 months. It is anticipated that the site work will begin in the summer of 2020. So I've never heard of a school getting built in 8 months. And I'm concerned that if you want to begin site work, that the kids won't have a place to go. So that's kind of the crux of my issue here. And I will point out that I did ask one of your board members, Mr. Palladino, with DevCo, and I did ask, and he didn't deny that the Lincoln Annex School was going to be the site. And I followed up since then on October 18th, 29th, 31st, and then again on November 2nd, asking some questions about that of him, and did not hear back from him. I don't believe he's here today. But I did get some answers through the PR people here, and I just wanted to know, I guess, if he was in the meeting with the Board of Education about selling the school. And
I don't know. But I know that he has notified the school district of the potential use of that site. Beyond that, I don't really know if he was in a particular meeting. There's lots of ways to get this done. So one is to build a new school. another one's to rehab another building. I'm not sure if those dates, construction dates move, or there's temporary facilities while something's being moved. I think what I can say with absolute certainty is that this health system and this hospital will do the right things for those students.
Well, I continue to be concerned for a number of reasons.
Not a doubt in my mind, so the way you go.
Well, I think it's just kind of crazy to frame it as, DevCo notifies the school, the school district, that their school might become something else.
I
The school
think
district
that's the
owns
right
it,
thing
it's
to do.
theirs, it's only theirs to make the choice to sell it, and ours as the
Well, I think-
public. And
What
so,
he told them was that the site was under consideration. It might be to the advantage of the school district. He didn't force anything down their throat. I think he did the right thing by being transparent and notifying them in advance that the site was under consideration. So, I don't see anything wrong. In fact, I see that as the way I would want somebody to deal with me.
well, did he notify the district before or after Langen Engineering was contracted to do a site survey and to look into this site, or was that, did that come
I
out?
don't know the date he contacted.
Okay, and I think
Nothing.
Mr. Morris had mentioned something about if you don't have the answers today, you'll be able to follow up and get them to me, is that?
Yeah,
Thank you,
we're not doing anything under the veil of secrecy.
thank you. I didn't mean to interrupt you if you had
No,
anything to
that's
say.
it.
Okay. And then, so I'll just, tell another issue from the neighborhood here. November 10th, 2004, the planning board in New Brunswick approved a resolution for the building right next to us. And included in the resolution is this quote: "The applicant,"
Did you say 2004?
yeah.
Okay. all right.
Yeah, so the applicant testified, the applicant would be Robert Wood, testified that there will be an interior walkway between the Child Health Institute and the proposed Children's Specialized Hospital that will connect French Street and Somerset Street. Quote, "The applicant will put up signs identifying the walkway and make it clear that the interior walkway is a public walkway." And I haven't yet raised this to your attention. I have raised it to the planning board's attention, but the building's out of compliance, has never been in compliance in my estimation. And this is, just another example of the hospital, unfortunately, letting the community down, breaking promises, where you can go see for yourself after the meeting. The French Street corridor where Magyar Bank once was is now kind of a vacant space. You've got an elevator that does not work, so for people with mobility impairments, wheelchairs, walkers, they cannot use the walkway because there's stairs. And the walkway is not open all the time, and certainly is not signed properly, it's not ADA compliant, so you're in violation of the planning board resolution that approved that, and it's not the first time that the hospital has broken zoning or planning rules. And so my conclusion here is that I'm skeptical that the community should give up something as important as a school to an entity that can't even be good stewards of the properties that they've taken over in the past. And the whole reason that this was even in this resolution is because Robert Wood has gobbled up, taken over two streets that no longer exist, Scott Street and Brown Street in the city of New Brunswick, as well as building in between all the streets that are still here. And as you point out, it's an enormous campus, and there's a need for a walkway to get from French to Somerset Street, and people are being inconvenienced and really not served well by the fact that you're not following that. And so I would just ask for action to be taken to correct that.
Yeah, so I really take offense at the fact that the hospital hasn't been good stewards of the property. I think we've been a great neighbor to New Brunswick. Every day, my team saves lives, and we do it with passion, and we do it very, very well. And we maintain our facilities, and healthcare is a challenging industry to survive in and do well in these days. And so I really have to take offense at that statement. The 2004 issue, I don't really know much about that. I'll certainly look into it. But we take good care of our property. We take great care of our patients. My people work far too hard for you to make those kinds of statements.
I think that everything I said was accurate, and I encourage people to check out that elevator, which has been out of service for years. So I don't think that's being good stewards. I'm sure there's a lot of good things you do, and I don't mean to offend you. What I mean to do is put these issues on the record and give you a chance to correct them or address them. And then finally, my last question is, I'm part of the 5th and 6th Ward Neighborhood Association here in the city. We're having a meeting on Monday, November 11th, at 300 Somerset Street, the Hungarian Building. And we would love for you or Mr. Morris or a representative of the hospital to be there to hear from the community and also share some of the great things that you are doing. So would that be possible? Could you have a representative attend?
We will check the calendar. As a Hungarian American, I will do my best to be there.
Awesome. Thank you for your time.
Thank you for your comment.
Hi, yes, my name is Danielle Moore. I am also a resident of New Brunswick. Wow, I see you really are desperate for the school over there due to where I saw you show a picture up there showing a bridge from, looked like it was from the hospital going exactly over to that way. But like Mr. Kravitz said, wow, no one really made anything out to the public. One thing I surely will speak about, where we will fight for our school, due to where that's one of the smartest schools in New Brunswick, due to where it just got awarded for being the smartest kid in New Brunswick, in New Jersey, the highest score, record-breaking. So yes, like I said,
think that's great. Congratulations.
yes, so why would you want to disturb our children due to where that is the smartest school? And you know, wow, once you do move to another location, how you have to get adjusted again, and that can mess with the child's brain. So yes, I will have to say I speak with Mr. Kravitz as a resident. We will fight for our school, so please, I hope you do look into another area to buy for this situation. Thank
So
you.
what picture were you referring to? Something.
One of the
is that-
pictures you showed with the emergency room, where it looked like it was a bridge or something going over towards that way.
That's the
I
bridge
think-
to the existing cancer institute. That's been there for 20 years.
Like I said, maybe I saw the wrong thing, but either way, I know you're still desperate for it, and I'm just saying we will try to do something to fight for our school. Like I said, that's the number one
I
school in
wouldn't
New
describe it as
Brunswick.
desperate. I think we want to do the right thing all the way around.
Well,
and
it would
that's
be
what we
right
will
to
do.
take out like I said, they're doing so good. You know, once you move from a house to another house, it'll take you time to get adjusted again. And same thing with the kids, where you can mess up, to disturb them. And like I said, wow, the smartest kids in that school. Sure, my child does not go there, but yes, I still would speak up. I seen them give out the awards, 2 weeks ago. Like I said, wow, the highest test scores in New Jersey. So yes, I will be with Mr. Kravitz and the rest of the parents to fight for our school. Thank you.
And I really mean it when I say congratulations on that. That's terrific.
My name is James Boyle. I live at 61 Gilden Street, New Brunswick. And I was just wondering, you mentioned that there were other sites for the Cancer Institute site that you were looking at, and B, that there were other sites possibly for the Lincoln Annex School kids to move to. And I'd like to know exactly what those sites are.
So I have no idea where the school might move to, or there's other people working on that. I just know that when the time comes, they'll find an appropriate site and they'll develop it, but I'm not privy to
So
where
would that site
they're
include
looking.
the warehouse school?
Say again?
The warehouse school that's currently operating?
You know, I'm not dodging the question, I simply am not privy to it, I don't know. But I am totally confident that we will do the right thing, so that I can say unequivocally.
And do you know where the other sites you're considering for the Cancer Institute?
Well, I think any property, just look at this campus and any properties that are near it, and there are not a lot of alternatives, but anything adjacent, anything that could be connected with a sky bridge is a possibility. Now, some blocks
So
are
there will be
totally...
a sky bridge?
If it were not directly on this campus, it'd have to be connected, because patients need to move back and forth. Anyone else?
I have something positive to share. Yesterday, I had a police officer who works here in town tell me that your new emergency room is above and beyond the best. And not only did he say that, but then an EMS person who was in the conversation echoed that the process is so simple now when they come and bring a patient in, that she calls ahead, that the band is already ready, that they have a bed already assigned, and she said it's just terrific, the operation in the emergency room. So I just wanted to give you that positive feedback.
Well, I appreciate that very much, and I think the only thing better than the facilities are our staff that work down there and our physicians, so thank you very much. That's hard work. My daughter's an ER doc, so it's not easy. Yes?
Hi, I just want to stress that this is Marge. She's actually my counterpart at St. Peter's.
Oh.
So that is an excellent compliment. Thank you so much.
Thank you so much.
I was reading under the radar.
I guess at this point, and I don't have the agenda in front of me, is Miriam?
I'm ready.
You're going to do some,
Yes.
okay. So, yeah, you're going to do your update.
So thank you again for being here and for inviting Community Health to do an update our community initiative. I want to recognize some of the members of our Community Relations Committee that are here tonight. Mr. Jose Montes is our chair. Thank you for being here. And also Marge, thank you. She's also my counterpart at St. Peter's. That we do a lot of this work that we're going to talk about together as partners. I want today to give you an overview of our community initiative, but I also want to talk to you about our community health needs assessment. And as you know, according to the Affordable Care Act, hospital needs to, every 3 years, conduct a community health needs assessment and a community health improvement plan. This is our third one. Now in 2019, we partnered with St. Peter's through our Healthier Middlesex initiative. We looked at secondary data, we do a community survey, and this year we did 2 additional community focus groups. The objective was to obtain opinion from our residents in Middlesex County and the Franklin section of Somerset related to these 4 buckets: health issues and concerns that impact the community, barriers to health care, strengths and opportunities that our community has, and personal health attitudes and conditions and behaviors. So as you see, we have them in these 4 buckets around health issues: obesity, substance abuse, mental health, chronic diseases like diabetes, cancer, and heart disease, and also those factors that contribute to these diseases like smoking, stress, aging are major health concerns. Barriers to health care, insurance continues to be our biggest issue, cost concerns, long wait times, scheduling, doctors not taking time, taking new patients are one of the top barriers. Language issues, especially with our Latino residents that are low income. Transportation continues to be also a cited issue among low income residents, and at least 72% indicated at least one of these barriers to care. In terms of the community, and this is what people's perception are of our area, which is mainly was, like I said, Middlesex County and that Franklin section of Somerset. You know, they consider that we still have good places to socialize, access to fresh food, safe places to walk, good places to raise a family. And this was clear more for higher income residents. African American thought that transportation was good around here. And our younger survey participant thought that there's a lot of opportunities for jobs in this area. We still have areas of concern around transportation, self-affordable housing, interpersonal violence or domestic violence, and healthy food choices for many of our community residents. In terms of personal health behaviors, residents self-reported being relatively in good health and exhibit positive health behaviors like having very good health or excellent health at 88%, or regularly eating healthy foods at 81%, have annual physical exam. Remember, this is all what self-reporting is. Physical activity at 71%, and children having breakfast every day at 82%. But we still have areas that we need to work on, especially in those healthy habits. Some of our residents describe that their health is fair or poor. It's like 12% do not eat healthy regularly, and 19% are not physically active at 29%. Many of them have been diagnosed, or a high percentage, with high blood pressure, cholesterol, and weight issues, and do not get mammograms or prostate cancer screening. And this is true for our Latino community that was cited as having less screenings than other residents. Also, in our secondary data, we saw that the percentage of C-sections was higher than the state, and the percent of first trimester care was also down. Around chronic diseases, mortality increased in 6 of our 10 leading causes of death. The percent of residents reporting diabetes also is worse, and more than 1/3 of our county residents reporting high cholesterol. Also, 50% of our oral respiratory lymphoma cancers are detected at a later stage of 3 or 4. Around prevention, we have seen that only 84% of our children are receiving the required immunizations by first grade. 60% of our Middlesex seniors are the only ones receiving a flu shot, and the percentage of adults with leisure time or physical activities is only 30%. Health status, environmental, and access. 15% of our residents reported their physical health is fair or poor. 11% of those 18 to 64 are without health care coverage, which continues to be one of our biggest issues. Our higher percentage of Middlesex County residents have limited access to healthy food than residents statewide, and burglary rates were in the worst performing quartile. So behavioral health continues to be one of our biggest areas, with 11% reported 14 or more days in at least 30 days with their mental health was not good. Binge drinking, also alcohol impaired driving is consistently high, and drug overdose has also increased. Like I said, once we look at this data, we looked at what areas were not present, like what voices we did not heard from what you just saw. And there were 2 groups that we decided to do a focus group. One was for people that work with young people in the county, and also the immigrant community. So for the focus group, we talked a lot about mental health issues in the young community. Many said that they have, issues with social isolation, anxiety, negative feelings of self-worth and belonging, trauma, depression, and coping with all of that is lack of coping skills. Substance abuse and vaping, and misunderstanding what vaping is and the consequences of vaping. Poverty and lack of resources and services for our county youth if they have substance abuse issues. There was a lot of talk about school lunches and not having healthy options within the schools, and parents are concerned about that, and also students not exercising because they're behind a computer or too many hours of watching TV. We also talked about what kind of things we can do. So they are mentioning that prevention needs to start at a really early age. Need to get everybody involved to work with these issues with our students, parents, schools, and community. Counseling and case management at the schools for students and families. An approach for these issues need to be different from one community to the other. What works in New Brunswick is not necessarily going to work in East Brunswick or in Edison. We need for comprehensive and innovative approach to teach student coping skills, leadership skills, resiliences, and self-esteem so they can survive in this new world that they live. When talking to immigrant communities, the key findings that we found was insufficient services for the demand that we have, lack of health insurance, lack of culturally and linguistic appropriate care, cost of care when they do have insurance, co-payments are very high. A lot of mental health issues that are now getting even worse because of the current political environment that creates fear to go out, stress and anxiety in the community. Lack of access to care, there's a lot of talk about transportation, language barriers, childcare, long waiting hours, lack of appointments, and cost of medication. Access to healthy food, and many of them mentioned that, we do have new supermarkets, we have farmers market, but the cost of the healthy food continues to be an issue for them. Possible solutions that the community came up with, start early detection programs in the community, just a place where you can go get your blood pressure checked on a more daily basis. Use of trusted messengers like community health workers. Empower communities to ask questions. Cultural awareness and bias training for our staff. Bilingual staff that can actually explain to patients in simple terms what is their diagnosis and what's their treatment. The use of community health workers at clinics and hospitals to advocate for patients, and increase evening and weekend hours. So from all those issues, we kind of looked at our priorities and what areas we can actually start moving the needle. So access to care, of course, and talking about transportation, availability of insurance, availability of services for mental health, more trauma-informed care, training, and services for youth that have issues with substance abuse. Around preventive care and vaccination, prevention around chronic diseases, and around various heart disease, diabetes and cancer, STI prevention and screening, vaccination use, and maternal and child health and prenatal and well baby care, which is something that just came up in our new assessment that had not been there before. And our last bucket will be around nutrition and physical activity, food security, and obesity. So those are our priorities for our community health improvement plan for our next year, which is 2020 to 2022. And I just want to give you an update of all our programs, so I'm going to do it as fast as I can based on our community health improvement plan. So this is the work we do through the Healthier Middlesex. We have our mission to collectively improve the health and well-being of our diverse communities through our partnership and individual groups and organizations. We have a website, and this year we developed a Facebook page. We have a number of organizations that partner with us to do this work. Our second bucket is around access to care. In this space, we have worked very hard around health information with our public libraries to make sure that they have the resources to give accurate information to our community residents. This is a project that we started with the East Brunswick Library. We actually got a grant last year from the New Jersey Health Initiative through the Robert Johnson Foundation, and we have what's called the Health Information Library on Wheels. So these librarians are everywhere participating with our residents in making sure they get accurate health information. This year already, they have seen over 2,500 residents. Around transportation, we sponsored a transportation symposium last year. And this year, we're working with the county and their new transportation office to move some of the issues that we found in that symposium the year before. Around goal 3, which is our prevention, we are working during our summer. We sponsor these Healthy Kids camps, and over 2,000 kids participated this year to make sure they have access to information regarding physical activity, healthy eating, bike safety. We also train a lot of the staff in their in the summer camps to make sure that they have ways to keep them active throughout the summer camp. And we also work in the policy space where 8 communities adopted healthy choices for vending machines in their areas of their summer program. We work with a lot of the partners from the YMCA to the fitness center to Keep Middlesex Moving and the health department. Around prevention, we continue to support our New Brunswick Ciclovia, which is an open street event that has the participation of over 1,800 people here in the city, and it's an opportunity for people to go out and exercise and look at additional alternatives that they have for exercise in our local parks. We continue to expand our childbirth education with our maternity tours, preparing, caring for babies, and we are anticipating that some of this work will be expanded this year because of the result of our community health needs assessment. We continue to work in our community with our seniors, providing screening and education in 10 or 12 of our senior centers throughout the county. We work with our young people to make sure that they have information about nutrition and fitness through our Project Inspire and our local Girl Scouts program. Around mental health and prevention, we sponsor an annual summer program for summer youth here in the city to talk about issues of healthy relationship, teen dating violence, and this year we had the opportunity to use some of the traditions of Sweet 16 or a quinceañero to teach them about this issue and actually give them a party at the end of the year. So it was a great experience for many of them. Around prevention also, many of the things that we see on our assessment is around asthma and lead issues. So for the city of New Brunswick, we were fortunate to get a bill grant from the Robert Wood Johnson Foundation to do a New Brunswick Healthy Housing Initiative. We started last year, and we reported here that we are doing an assessment, going into homes, doing assessment around the 7 principles of a healthy home. And many of the issues that we have found is around tenant landlord issues and our residents not knowing their rights, and some of our landlords taking advantage of them. So we have been working now with the city. We were able to complete that grant. We got a second grant, also a Bill Health Challenge grant to look at policy with the city. The city has been very welcoming of this work. They are our partners in this process to look at ordinances and policy around housing in the city so we can change some of them, revise them, so to make sure that our residents have a better place to live. We're also working with other organizations doing substance abuse programs in the school, promoting the use of medicine drop boxes with our police department. And as many of you know, we are out there doing a lot of community health fairs and screenings. We have monthly eye screening, cervical cancer screening that we do with the medical school, community flu shot clinics, and breast cancer screenings that we hold with our breast center. In the area of mental health, together with the medical school, we put together a behavioral health resource guide that we've been going out into the community, promoting the guide, training people how to use it. We translated the guide into Spanish this year so more people have access to the information. And we're hosting mental health first aid training for individuals and organizations throughout the county. More disease specific, we work a lot around diabetes. We have the only Spanish-speaking diabetes support group in the city that provides chronic disease management, support group, fitness vouchers. We do some work around heart disease. Last year we had Chef Carla Hall come and do an educational program multiple community support groups around many of the chronic diseases that we have mentioned. Around obesity, we work with Rutgers and their SNAP program to provide education throughout the city. We also host the New Jersey American Parkinson's Disease Association Information and Referral Center that offers a number of programs for people with Parkinson and their families. And I always want to finish by saying that we couldn't do this without the support of our employees here. Every year, our employees go above and beyond what they do every day to support our very needy families through our adoptive family, our turkey donation, our annual day of service, our holiday celebration with the kid, and our disaster relief donations. And I must say they're a great group to work with. Thank you. Good night.
So that concludes the 2019 annual public meeting. I just want to thank everybody for taking time out of your busy evenings and showing up and listening to us, hearing us out, and keeping us on our toes. And with that, I wish everybody a safe travels home.